Hello, I'm Dr. Greg Forrest, a board-certified chiropractic neurologist, certified in applied herbal sciences and acupuncture. I'm trained through the Autism Research Institute, and I'm a registered Defeat Autism Now doctor. I'm clinic director at the Pain and Brain Healing Center in Blaine, Minnesota. I'm also author of the best-selling book, Why We Hurt and How We Heal. And as an international lecturer to the doctors and public, I get asked many questions. One common question is, can low thyroid symptoms be conquered naturally? Many people live their lives suffering with low thyroid symptoms such as fatigue, constipation, weight gain, brain fog, depression, digestive problems, sugar cravings, cold hands, cold feet. It's especially experienced by many women. Your thyroid produces a hormone that controls cellular metabolism. So if it's not working properly, the cells of your body and brain can slow down because they're not being stimulated properly by the thyroid hormone. This can create many of the symptoms and much, much more. The doctor usually to this will do the usual approach, which is to measure a hormone that comes from the pituitary gland, from your brain, called TSH, which stimulates your thyroid gland. Then they'll measure T4, which is the thyroid hormone. If the results are within normal range, the individual is told that their thyroid is fine. If the person's TSH is high or their T4 levels are low, the doctor many times will prescribe a synthetic thyroid hormone called Synthroid. The problem with this is that the simple approach is just too elementary for this complex syndrome that so many people continue to suffer with, even after they're taking thyroid medication. Moreover, even after the doctor tells them that their thyroid tests are now in the normal range. One big problem is that many times a doctor does not run a comprehensive enough thyroid panel. Another issue is that many times an individual thyroid test results may be just within the normal range, but this barely normal enough is not good enough to run cellular metabolism properly. Complicating this picture even more is the fact that there are actually 6 patterns of thyroid dysfunction, and they must each be properly diagnosed and treated for an individual to recover. These thyroid panels all respond well, don't always respond well to the thyroid medication. One of these patterns of thyroid dysfunction is called Hashimoto's disease. It is the most common cause of thyroid dysfunction and symptoms in the United States. Hashimoto's disease is a specific autoimmune disorder causing you to attack your own thyroid. Autoimmune disorders are on the increase. We see more and more of them. Lupus, rheumatoid arthritis, many of them. And it's an autoimmune disorder is where your immune system actually turns and attacks your own tissues. Now, why would this be? Many times food allergies are playing a role because they're ramping up the immune system and you're overly aggressively attacking tissues then. Or chemical sensitivities. These chemicals in our environment or toxic metals can act as haptogens and stimulate your immune system and lead to an autoimmune disorder. Therefore, common causes of Hashimoto's disease, as pertaining to the thyroid, are allergic reactions to foods, molds, bacteria, or chemicals and heavy metals. So, when this happens, your body produces antibodies to enzymes in your thyroid, which can be then measured to identify this common disorder. So once the underlying, which of the 6 thyroid issues that you have, we then address it with a biomedical approach. And again, the 3 R's of the guiding principles are remove what's causing harm and possibly creating an autoimmune reaction in the thyroid. So in other words, we look to test to see if chemical exposure has been an issue, toxic metals in your system, or even GI gastrointestinal endotoxins from gut bacteria. Then we do tests to find out what needs to be restored, the second R, to restore any nutrients that the thyroid may need, like tyrosine or iodine or methylation components like folic acid. All these are then tested for. And then we put together a program to help repair any damaged tissue, such as the thyroid itself or the peripheral tissues that must respond to thyroid hormone. Care at my clinic utilizes a step-by-step approach. We'll do a comprehensive review of your health history and then do a thorough exam. Based on these results, laboratory tests through blood, urine, and stool are performed to rule out any pathology and provide vital clues on what road to take to optimize cellular function and real healing. Added to this is a very comprehensive thyroid panel. Look at the many different factors of thyroid dysfunction, from measuring the active free T3 to looking at thyroid antibodies. Then problems for maldigestion, malabsorption, leaky gut, and dysbiosis are identified through specialized laboratory testing to see if this is a factor in your thyroid symptoms. Many times the source is chronic inflammation, autoimmune reaction, and so this needs to be tracked down. A urinary organic acid profile can be utilized to see if your tissues are actually producing proper amounts of ATP or energy when stimulated by thyroid hormone. Also, food allergy tests can help us track down any food allergies that may be leading to Hashimoto's disease. At this point, a specific diet and supportive nutrients are put together in a biomedical plan for you, depending on what is found on history, exam, and clinical lab results. Also, we will utilize toxic metal tests to see if lead or mercury needs to be chelated out of the body. So what are you waiting for? When so many other individuals have already been found to find recovery, you want the very best for your life. It may take some time and effort and money, but you can achieve it. Imagine how it would feel to be able to do all the things you desire. What would that be worth to you? Call the clinic today at 763-862-7100 and see how easy it is to get started on your biomedical recovery to thyroid symptoms.